So this is Unit 9, Antifungal and Antiviral Agents. These are your objectives and reading assignments. All right, so let's talk about antifungal and antiviral agents. So first, let's talk about antifungal agents. So indications, obviously, these are antifungals. So this is to treat susceptible fungal organisms, commonly Candida, coccidioids, and Aspergillus. So at times it can be from different sites of infection. It can be from oral, esophageal, skin, pulmonary, vaginal, and systemic. The most common condition that we treat here in Kern County would be, well, the most concerning one would be valley fever. So basically, cocci or valley fever. Therapeutic action, it depends on the drug, but let's say it's amphotericin. So amphotericin B act on the fungal cell membrane, causing the fungus to die, so killing the fungus. Other medication, it will have fungicidal or fungistatic effects. So it can either slow the growth, right? Fungistatic, it slows the growth and multiplication of the fungus, or fungicidal, basically killing the fungus. So the effect depends on the concentration of the drug. And so the higher the concentration, the more fungicidal it will be. Side effects. So side effects include headache, nausea, vomiting, liver and renal dysfunction, or toxicity. So know that all antifungal agents will affect the liver. But in addition to that, specifically, amphotericin B not only affects the liver, but it can be quite nephrotoxic. So it can be very toxic to the kidney. So know the side effects of amphotericin B. Side effects of ampho B, which usually that's why we require pre-medication before giving this medication, include fever, shivering, renal and neurotoxicity, and cardiac dysrhythmias. And so that's the reason why we give pre-medication, because it can have severe side effects. And that's also a reason why they typically don't start the patients on ampho right away. So typically they start other anti-fungal medication for valley fever, and if it doesn't work, or if it's a disseminated version, like a worse version of the fungal infection, then they may start the patient on amphotericin B. But we have to be very careful because, again, of the side effects or the severity of side effects. Precaution, renal or liver impairment. And again, these medications of antifungals tend to have many drug interactions. Contraindications. So absolute reason why we shouldn't give antifungals are because of liver failure. So you don't give this in patients who have liver failure. Now, nursing actions, knowing, right, the side effects, we want to follow the LFTs or liver function test, as well as the renal function test, which is your BUN and creatinine. In addition to that, as I mentioned earlier, it is also important to ensure that we are pre-medicating our patient when we're giving amphotericin B. Examples of drugs under this class, so most of your antifungal drugs will end in azole. Fluconazole, right? Ketoconazole, and miconazole. Another one that's a little bit off, it doesn't have the same suffix, is nystatin. And the main one that is a little different compared to the other one and the ones with so many side effects is your amphotericin B. All right, so all of these are antifungal, and you have to know all of the medication that has an asterisk beside it. So fluconazole, amphotericin B, nystatin, ketoconazole, and miconazole. And as I mentioned to you guys earlier, it may be I may ask you specifically, what side effects will I expect if a patient is going to receive fluconazole? Or maybe a more generalized one. What side effects should we expect when giving antifungal? So that's why it's very important to know the drug names and what farm class do they belong to. Some other antifungal agents can be topical, and so this is more the use is more for local infections. So it can be on the scalp, again, oral area, maybe on the groin, feet, right? So examples of topical antifungal, you have topical nystatin, clotrimazole, ketoconazole, and terbinafine. So indications, the reasons why we give topical antifungal agents include local candidiasis, so it can be oral, vaginal, nail, skin, so tinea, so it can be tinea capitis, so in the head, tinea cruris, basically in the groin area, uh, tinea corporis in the body area, and tinea pedis, which is in the feet. So those are reasons why we can use topical antifungal agents.